This film documents the journey of Dr. Mohamed Reda, a psychiatrist who founded mental health services in Kuwait and opened the door of hope for patients who had long lived in darkness, neglected and forgotten. This journey would not have come to light without coinciding with the start of Kuwait's major renaissance. With the appearance of oil in the Bergen oil field in February 1938, a new dawn arose for Kuwait. The first shipment of oil was exported in June 1946, marking a pivotal chapter in the country's history. During this period, Kuwait's economy shifted from reliance on traditional, arduous industries such as pearl diving, fishing, and shipbuilding to a flourishing oil era that ignited a comprehensive renaissance. In the early 50s, the Public Health Department began implementing a series of ambitious initiatives aimed at developing the healthcare sector, including recruiting qualified medical professionals for various specialties and paying special attention to improving conditions for mental patients. At that time, these patients were held in a building in the Shark area opposite the Alhambra Cinema, known as the Asylum of Lunatics, which lacked medical and humane standards and had no specialized therapeutic vision. Amid this harsh reality, in September 1955, a significant step toward change was taken when the Public Health Department brought a young Egyptian doctor distinguished by his knowledge and humanity, Dr. Mohamed Reda. He was a psychiatrist who would write the first chapter of the history of mental health in Kuwait. At that time, mental patients in Kuwait and many Arab societies were regarded as suffering from possession, envy, or magic. Their families often resorted to shamans and magicians to invalidate the magic or to cure envy through charms and amulets. Generally, patients were subjected to severe beatings and burns to expel demons from their bodies during specific rituals. Thanks to his scientific and practical competence acquired through his work at the prestigious Al Abbasiyah Hospital for Nervous and Mental Diseases, along with his deep humanitarian commitment and his fruitful professional interaction with colleagues, Dr. Talaat took the lead in founding and developing mental health services in Kuwait. Dr. Mohamed Talaat obtained his bachelor's degree in medicine and surgery in 1946 from the Medical College at Cairo University, formerly known as FOAD, the First University. He then earned a diploma in nervous and mental diseases in 1948 from the same university. Dr. Talaat documented his experience in an article published in Al Arabi magazine in December 1964 titled The Development of Mental Illness Treatment. In it, he described the state of the Asylum of Lunatics upon his arrival in Kuwait in September 1955, saying, "The place was merely a small, makeshift building established in the late 1940s as a temporary clinic consisting of a single floor. It comprised narrow, dark rooms and small high windows surrounded by iron bars without beds. The floors were sandy, and the ceilings made from black wooden beams. This floor contained 4 yards, each with a large iron cage in the middle where some patients were confined. There were no medical records, no medical supervision, and no therapeutic or medication plans for the patients." The American psychiatrist Nathan Klein, one of the most prominent researchers in psychiatry, documented this case in a scientific paper published in 1963. In it, he described the condition of the hospital upon Dr. Talaat's arrival as being closer to a prison, as it housed 25 patients without medical records or any form of psychiatric treatment. He also mentioned that one psychiatrist had worked there briefly in the early 1950s, but could not bear the situation and left, leaving the patients under the supervision of a general practitioner who visited them once every week or two, while the actual care was provided by 3 or 4 attendants. Some of the patients were chained and fastened to the walls in separate cells, while others were confined during the day in a cage the size of a room. In light of this scene, Dr. Mohamed Talaat took the initiative to transform the asylum into a fully integrated treatment unit. He began by removing the cages and opening the small rooms to form a large ward that included spacious rooms meeting health standards and equipped with patient beds. The floors were tiled, the ceilings painted, and air conditioners and fans were provided. He also converted one of the annexes into an outpatient clinic, a pharmacy, a laboratory, administrative offices, and a cinema hall to entertain the patients. Later, a new floor was constructed according to the same specifications. Dr. Talaat did not stop with these amendments alone. He found that the situation required expanding the provision of distinguished mental health services. Therefore, he submitted a request to the then Minister of Public Health, the late Sheikh Fahad al-Salam al-Sabah, to establish a modern psychiatric hospital, which was approved. Thanks to Dr. Talaat's foundational efforts, the Nervous and Mental Diseases Hospital was officially opened on December 23, 1958, in the health zone of Salibikate. At the time of its opening, the hospital included 4 wings for both men and women, with a total capacity of 91 beds, in addition to buildings for administration, pharmacy, laboratory, and a cinema hall. Dr. Klein emphasized in his research that the hospital's medical records were excellently maintained and formed a treasure trove of information that could be used scientifically. Dr. Talaat took over the management of the hospital as its first director since its opening in 1958 and continued in this role for more than 25 years. During that time, several types of modern psychiatric treatments from Europe and America were introduced, such as medication therapy, insulin therapy, and electroconvulsive therapy, ECT. He was a pioneer in introducing general anesthesia for ECT sessions. In addition to his administrative and medical duties, Dr. Talaat gave significant attention to the training of medical staff. He worked on preparing general practitioners to diagnose mental health conditions and recommended some of them for overseas training in neurology and psychiatry. He also contracted with psychiatrists to keep up with the increasing number of patients. By 1964, the hospital had expanded significantly to include 13 new wards, bringing the total capacity to 465 beds, in addition to a recreational club, gardens, and a cinema hall to support social rehabilitation programs. Therapeutic vocational training, such as carpentry, agriculture, and weaving, was also introduced. The hospital also provided accommodation for doctors and nurses. Thus, the hospital became the first government institution specialized in neurological and psychiatric diseases in Kuwait and the Gulf region, leading to the eventual closure of the old hospital. Among his most notable achievements was granting patients the freedom to come and go and to receive visits from their families, which changed the societal perception of mental illness, shifting it from a societal stigma to a treatable condition. Dr. Talaat is also considered the founder of the non-biological psychiatric treatment school in Kuwait, which relies on psychological sessions and behavioral therapy. This contributed significantly to improving the mental health of patients using modern and effective methods. During that period, the Kuwait Psychiatric Hospital was the only hospital of its kind in the entire Gulf region, which gave it a prominent regional status. Patients from various Gulf and Arabian Peninsula countries flocked to its seeking treatment, keeping the hospital operating at full capacity at all times. The hospital's excellent reputation was closely linked to the high quality of its services, including clean, comfortable, air-conditioned rooms and television sets provided for patient entertainment, as well as longer visiting hours compared to similar institutions. This was documented by journalist Claudia Farkas Al-Rashad in an article published in the Arab Times on August 7, 1979. Since founding psychiatric healthcare in Kuwait, Dr. Talaat sought to benefit from international expertise. He visited the Asfuria Hospital in Lebanon in 1956, then conducted a tour of Britain and Europe in 1962 to study the latest methods in treatment and hospital administration. During the 1960s and 1970s, he received several World Health Organization (WHO) experts, including Dr. Tijani El-Mahi, known as the father of African psychiatry, and Dr. Taha Bashir, to evaluate and develop psychiatric services in Kuwait and promote the exchange of knowledge. These experts praised the spirit of cooperation among the medical staff, the exceptional patient care, and the adoption of modern therapeutic systems led by a highly skilled and experienced medical team. Dr. Talaat also built international collaborative networks with professors from Britain and Germany to evaluate and enhance psychiatric services in Kuwait in line with global standards. One of the most notable visits was that of Professor Sir William Henry Trethewin from the University of Birmingham, United Kingdom, in March 1969. Professor Trethewin toured the hospital's various departments and wards, reviewed the treatment protocols in use, and met with doctors and nursing staff. He praised the level of medical services, the use of modern therapeutic methods, and the high academic and cultural caliber of the medical team. He also provided recommendations that significantly contributed to the development of mental health care in Kuwait. Dr. Talaat Reda represented the state of Kuwait at the World Federation for Mental Health in Zurich, Switzerland, in 1957, making him one of the first Arab representatives to participate in this prestigious international forum. He also took part in several World Health Organization (WHO) international conferences aimed at enhancing cooperation in the field of psychiatry, most notably his membership in the Kuwaiti delegation to the First Arab League Conference on Mental Health, held in Cairo in 1970. His participation in the WHO Regional Seminar on Mental Health Legislation, also held in Cairo in 1976. During these conferences, Dr. Talaat presented Kuwait's experience in establishing the Hospital for Neurological and Psychiatric Diseases and discussed treatment policies and patients' rights. On the academic level, Dr. Talaat authored a book titled Principles of Neurological and Psychiatric Diseases, published in 1975. In this work, he compiled his theoretical and practical expertise, presenting it as a comprehensive and accessible reference that covered the fundamentals of diagnosing neurological and psychiatric disorders and their modern methods of treatment. The book addressed topics such as the causes of neurological and psychiatric diseases, personality structure, neurological disorders such as epilepsy and multiple sclerosis, as well as psychiatric disorders including schizophrenia, depression, and anxiety. This book was adopted as part of the curriculum at the Nursing Institute in Kuwait, where Dr. Talaat himself taught it. It served as a primary reference to help students understand the nature of psychological and neurological disorders and the proper ways of interacting with patients and their families. With the oil boom and increasing prosperity, the problem of addiction emerged in Kuwait. Dr. Talaat tackled this issue by designating wings within the hospital for the treatment of addicts and implementing a comprehensive treatment program that combined medical treatment, medication, and psychological and social support. Journalist Claudia Farkas Al-Rashad noted in an article published in Arab Times on August 7, 1979, that addiction at that time was more associated with wealth and the pursuit of pleasure rather than poverty. One of the significant challenges was the widespread use of the drug Mandrex, which became a serious issue. The first official addiction treatment center was opened in the mid-1980s with a capacity of 60 beds. The Hospital for Neurological and Psychiatric Diseases, which was later renamed Psychiatric Hospital, continued this approach until the establishment of the Addiction Treatment Center in 2005, funded by the Kuwait Finance House. In 2015, this center became independent from the Psychiatric Hospital, currently known as the Kuwait Center for Mental Health, and operates as an independent entity. Dr. Talaat received widespread recognition for his pioneering contributions to the establishment and development of mental health services in the state of Kuwait. Some of his major honors included receiving the Fellowship in Psychiatry from the Royal College of Psychiatrists in London and being selected as a founding fellow in 1973, granting Kuwaiti citizenship in 1975 in recognition of his distinguished services and notable achievements in the field of mental health, as well as for his role in establishing the first hospital for neurological and psychiatric diseases in Kuwait and the Gulf region, elevating it to modern standards. Recognition by the Kuwaiti Medical Association in 1984 during a special ceremony honoring the first generation of doctors in Kuwait in appreciation of his pioneering role in the establishment of mental health services in Kuwait and his outstanding professional career, which spanned over 30 years in the service of patients and the development of the field of psychiatry in the country. In the early 1980s, Dr. Mohamed Talaat Reda was appointed psychiatric consultant at the Kuwaiti Ministry of Health, where he contributed to the development of mental health services, formulated national policies, and updated treatment protocols in line with global advancements. The Psychiatric Hospital, currently the Kuwait Center for Mental Health, which he founded, became a prestigious center for training doctors and medical students in Kuwait and the Gulf region. Dr. Talaat retired in 1986 after a career filled with significant achievements. He passed away at the age of 71, leaving behind a professional and humanitarian legacy that continues to inspire generations.